So here we are after the 2nd of April, when this data suggested that we were going to cross 1.2 lakh cases in a finite period of time on a 24-hour basis. We are now in a situation when our healthcare workers are struggling to ensure that patients in hospitals actually survive. Oxygen is a big problem. What really is the road ahead? We've all heard about the cases. It's time perhaps to look at the challenges we face and to look at some solutions. And who better to do that than Preetha Reddy, Executive Vice Chairperson of the Apollo Group of Hospitals, who joins us now. Thank you, ma'am, very much for being with us. First up, and I must confess, I've been discussing, the fallout of COVID on a daily basis almost. We just don't talk about doctors enough. We interview doctors, but don't talk about what's happening to them in hospitals, or frontline healthcare workers, or janitors, or nurses, or sanitary staff, or even cooks. These are people who make up the heart of your team. Can you tell us what they are doing to keep people alive now?
Thank you, Vishnu, and I'm, appearing here on behalf of 60,000 plus of Apollo staff and the entire country's healthcare workers. As we speak, in one location, I have two youngsters who are, between 30 and 40 years of age, who are literally battling for their lives, healthcare workers, frontline workers. And I mean, the whole organization is praying that they will come out of it. They're on the ventilator. They've had the best-in-class treatment. I have a young doctor here who hasn't gone home to see, he's had a baby, 4-month-old baby, and the only time is FaceTime. So, they talk to each other on FaceTime, but he says, no, this serving people or working in the front lines is more important. I will get some time off to be with my little child. There's a girl from Kerala, father died 2 weeks ago. She hasn't gone home because she feels, she's needed here. So I think the healthcare workers really, really have to be acknowledged within our country, outside our country, because everyone is literally working in the front lines. And to me, thank you, gratitude, whatever we do for them is just not enough. It's like there is so much to be done and to be thankful for. Of course, many steps have to be taken, but I must say that as a country, with the magnitude of the problem, so much has been done. Every time we started off saying we don't have PPEs. Today, India is producing PPEs for the rest of the world. We started off saying we don't have ventilators. Made in India ventilators are making the rest of the world look up. Innovation labs are innovating like real time, 24/7. And as I say this, we have the largest pharmacy chain, and our pharmacists are serving people literally 24/7, taking drugs to old people, people who can't really find, reach, access these. So I think this kind of work is going on in every part of the country, whether it's a small nursing home, a large hospital network, whether it's in the government hospitals, or whether it's, in the small public health centers. People are really working, they're giving more and beyond what they can serve, sure, because that's really the spirit of service. We are in a warlike situation, and we all have to work together for this.
So in this warlike situation, there are casualties, and there are casualties among doctors and healthcare workers as well. Many of them certainly fall ill. And therefore, how much of a challenge has it been for you in your hospitals to deal with the fact that your own doctors are falling unwell, your own healthcare workers are falling unwell, and therefore those who are still trying to save people or help people are that much more tired, more stressed, with so much more to do?
So, Vishnu, one is, if you just take some data and analytics, it's not as if the percentage of healthcare workers are falling ill. They are tired, they're exposed, and we have to look after them, yes. But I think generally the spread is there, and the spread is a lot. So the public at large is at risk, including our healthcare workers for sure. Mm-hmm. We as an organization have set up, quarantine facilities purely for our own staff and our workers, because they need it, and we're able to give that to them. In the event of they need care within the hospital systems, they have beds, and they will get the best in class whatever is available, because I think they deserve it. They're like our family. but just scaling up is what we've all been focusing on. We've tripled the number of ICU beds in each one of our hospitals. And, we're talking about 70 hospitals, and each one of them has ICU COVID beds. We've got AI, which is, again, a very innovative model done by my sister, where people can actually check into a hotel to quarantine themselves, and they will be monitored real time with technology and nurses. So that is happening. Apollo 24/7 is providing, again, 24/7 care for people at their homes whenever they need and consultation. So at any given time, Apollo as a group, today's number is 14,080 people being looked after,
Wow.
throughout. We can do much more. We
Sure.
need to do much more. I'm not, applauding ourselves. I just feel that we have to come together to do that.
Sure.
That's what I really feel.
So let me ask you a little bit about the government's plan to bring in final year medical students. It seems to suggest that, people are falling ill or we need more healthcare workers. What are your thoughts? These are all young kids in a sense, final year students still under supervision, being brought into a war zone. Your thoughts? I don't have a specific question on this.
So frankly, Vishnu, we don't have an option. Both final year nurses, final year medical students, and skilled workers in the healthcare space are really required. What we need to do is to give them proper protocols, give them like a mentor or guide. So typically there would be one experienced doctor, and under him 10 of these, because the bedside care, a lot of stuff, entry into the computer, a lot of stuff which can be done by somebody who's just intelligent and who's trained to this level. That load can be taken off from the more skilled people. So I think we need to do different layers and levels of skilling and get more people on board, because honestly, frankly, we don't have an option. So I think the policy decision to allow the final year students to come and work on the front line, the policy decision to move NEET by 4 months, to reward people who've done more than 100 hours of COVID duty, all this are steps in the right direction, because it really motivates people. It motivates the frontline workers who are tired. They know that at least somebody is giving them reinforcements. We ourselves from our medical schools have mobilized 2,000 people from our nursing schools and medical schools.
And are they enthusiastic? They want to get in over there, get the experience?
They're very enthusiastic. They're like passionate. They're young. They really want to make a difference. And I think that's important. Even if you hold somebody's hand and help them through the tough times, it makes a difference.
So let's talk about the other big issue at this stage. That, of course, is oxygen. Could you tell us a little bit about the existing oxygen infrastructure that you actually have? And that's been improved of late because you've got a plant which has also come into Delhi. How soon would that plant, and I think it's come from France, right? Correct me if I'm wrong. How soon would that be mobilized in your hospital? And, if you look at the long-term requirements for infrastructure, what can we learn from what we are going through now?
So, this definitely is a topic which has come up now and which is so important. One is that we need to thank countries in Europe or US or even Singapore for that matter for lending a hand, turning things around so quickly to help us with oxygen. As far as the oxygen is concerned, it was in a way unanticipated. We never realized that the requirement of oxygen would go up by 300 times, right? Because there were that many patients needing oxygen. Also, the silver lining here is that only 17% of oxygen produced in the country is used for medical purposes, which means that there is oxygen, industrial oxygen, which can be converted to medical use as soon as possible. And now, of course, there's this wonderful train carrying oxygen. So many things are happening, trucks carrying oxygen, people swinging into action. So I think the private sector here has really stepped in to say that, we produce oxygen for our steel plants, for other requirements. Please take it and use it for our patients. So, you see a wonderful coming together of industry, of government, of healthcare providers to overcome this. Yes, we still have a few days more of literally living with our heart in our mouths, but I think we will overcome that. As far as the plant is concerned, it's being commissioned, I think, in the next 24 hours. So it will take care of a small percentage in one hospital of what we need, but definitely it is a lifesaver.
All right. One final question, ma'am. The emergency use of essential drugs. A lot of people would say our system is very slow. Perhaps it needs to be slow because it's a safety issue at the end of the day. But in a situation like this, what about emergency use authorization of essential drugs? Does that process need to be made faster?
I must honestly say that it's so much better than what it was once this crisis happened, especially during the second wave. But having said that, the monoclonal antibodies, which we really need to start using, which means we have to get into clinical trials and use them. This tocilizumab, again, is, it's become a very rare drug, and we need to get more of it, use it, get whatever certification required and make it available. Step up production of remdesivir, because we know that that is making a difference. The clinical teams are really saying that we need that. So I think multiple interventions like this have to be done. It's never going to be quick enough.
Right.
You might say, I wanted it yesterday. But the thing is, now it is moving at a certain speed. We can double our speed. We can take a risk that we do it for clinical trials. So I think we should step up the number of clinical trials which are happening in the country. And I think the scientific bodies in all the government bodies are very conscious of it. And I'm sure that it will happen soon.
Wonderful speaking to you, ma'am. Thank you so much. And hopefully those healthcare workers will find themselves in a better spot.
Stay safe, say a prayer for all our healthcare workers, and all of you be careful.
They are our real soldiers in this situation, always. Thank you, ma'am. Thank you so much. Wonderful speaking to you.